Madam Chair, members, House Bill 2727 appropriates $1.5 million from the State General Fund to the Arizona Health Innovation Trust Fund in fiscal year 2027. The bill also appropriates an additional $1.5 million from the State General Fund to the Trust Fund for the State Treasurer to allocate to an entity to conduct a pilot program that focuses on health innovations for persons living with chronic conditions. Finally, the bill declares that the legislature intends that the monies in the trust fund steadily grow to ultimately maintain a permanent endowment balance of at least $200 million. And with that, I'm available for questions.
Members, any questions for Logan? All right, well, let me explain the background to this bill. I'm one of the co-chairs for the AZ Bio, and we're trying to get out education and learning about this. I don't know if you heard, we had kolaches the other day to bring people down and do some education. But this is a real important thing for Arizona and the bioscience industry. The Health Innovation Trust Fund was established in 2022, so this is not anything new. This was in order to advance health innovation in Arizona and develop our healthcare workforce. We have a lot of potential in Arizona in this industry. This bill has been double assigned, so it's important to get it out of this committee and into Appropriations Committee to be heard so that it can then be negotiated in the budget process. And with that, I'm going to leave the specifics to our speakers. Mr. Vice Chair, anyone signed in opposition? I don't see any. So let's start our list of those in support.
Joan Kerber-Walker.
Good evening, Madam Chair, members of the committee. Thank you for your patience in sticking with us through this long session. My name is Joan Kerber-Walker. I am testifying as myself. I am employed by the Arizona Bioindustry Association as its president and CEO. So, as the chair clarified, the Health Innovation Trust Fund is not new. It is, however, unique. There is no other state in the nation that has used this type of a strategy to try and bridge the gap between what happens in its research bases, like its universities and hospitals, and how those things get commercialized. And so here in Arizona, the strategy was that we would capitalize the trust fund, and the trust fund would fund the innovation pathway. The challenge that we have is that because we have not in past budget years been able to fund the trust fund, pilot funds are necessary. So what this bill does is it starts the process of funding the trust past its current level, which has not had any new capital in it since its creation in 22, and then it will give us a pilot program to start moving some of these things forward. There was a small pilot program last year that was funded by this legislature of $150,000. That went on to create four innovation programs specifically focused on veterans. Those programs are ongoing right now in 2 rural communities as well as 2 urban communities. I'm happy to answer any questions.
Members, any questions? All right, thank you very much. Appreciate you. All right, Mr. Vice Chair, next speaker.
Primo Castro.
Welcome to committee.
Thank you very much, and good afternoon. Madam Chair Bliss and members of the committee, thank you for the opportunity to speak today. For the record, my name is Primo Castro, and I'm here on behalf of the Biotechnology Innovation Organization in strong support of HB 2727. Arizona has worked hard to build a competitive, high-growth life science ecosystem. HB 2727 strengthens research, emerging technologies, and partnerships that helps translate scientific breakthroughs into real-world health solutions. This investment is not only about innovation, it is about economic competitiveness. States across the country are actively investing in biotech and advanced research infrastructures. HB 2727 ensures that Arizona remain a destination for companies developing new therapies, diagnostics, and digital health tools. Most importantly, this fund accelerates work that directly benefits patients, expanding access to cutting-edge treatments, improving care delivery, and supporting innovations that can reduce long-term healthcare costs. We respectfully urge your support for HB 2727 and appreciate your leadership in strengthening Arizona's role as a national hub for health innovation. Thank you. Last thing I just want to add is, of all the states that I know that are under my portfolio for bio, obviously Arizona, and and Joan is one of my by far favorite affiliates under the bio umbrella. So.
Members, any questions?
Madam Chair,
Please.
so are there a lot of administrative fees? So you've got $3 million budget of some sort. What are the administrative fees?
So, I don't have that.
But I believe Joan does, so let's bring Joan back up to the podium.
Madam Chair, Dr. Heap, so the way the structure of this program is put forth, I think you're talking about the administrative fees for the pilot program, the 1.5 million, or the trust fund. Can you clarify that for me?
Well, either or, I guess would be
Okay.
both would be good.
All right, so, Madam Chair, Dr. Heap, the way that the trust fund is set up is it is administered by the state treasurer in perpetuity underneath the Board of Investments. So the trust fund itself is then, the corpus is grown by the state treasurer. The statute designates a 4% distribution from the trust fund upon maturity, which it will not mature until fiscal 2027. Once the trust fund is distributing, then 4% goes to so that's all managed by the treasurer. The contract with the treasurer's office has roughly a half basis point for management, which is managed by the trust. And it's the same structure that is used for the pool that's used to manage investments for the cities and towns. Relative to the distributions, so the distributions go to a 501c3 who then manages that process. The 501c3, in this case contracted by ASTO, is the Opportunity Through Entrepreneurship Foundation, which manages the AZ Advances program. That program is supported by both AZ Bio and by the Opportunity Through Entrepreneurship Foundation. At the current time, as far as the fees or administration, there are no fees or administrative fees being charged against the small pilot program. It would be determined as far as what the administrative fees would be, but minimally less than the 10% normally used by the state as the standard.
One more question.
Please.
Madam Chair. Thanks a lot for answering that. And the other concern was, it's kind of the appropriations went to a wide range of different items. What's the process for determining who, gets the appropriations? Because it's a wide range of things you're
Madam
doing.
Chair, Dr. Heap. So basically what we looked at is using the pilot program as the standard. The statute, what was defined by the legislature was very specific. They had to be programs that were in health innovation, focused on improving health. And under the trusteeship of ASTO, we spoke with them and they said the way the statute is structured, health innovation workforce. So with that small grant of $150,000, the way it was done is we put out a call for proposals across the state, was public for over 30 days. We then collected all of the proposals. Those proposals were then reviewed for technical merit by the scientific community, for how this would impact our veterans in this case, by members of the veterans community, both nonprofit and at the VA. We worked with different organizations to score those, and then based on the scores, the grants were awarded. Now, in the case of the innovation grants, there are 3 of them. One is focused on telehealth, specifically addressing the needs of veterans in our rural communities, and trying to better determine the standards for that. The second was a company called My Health, which is in partnership with Mayo Clinic and a small community health center in Casa Grande, who is working on the care, when a patient presents in the care facility, managing their data and better applying AI to help the doctors with that administrative process. And then the third is Regenesis Medicine, which is a Scottsdale company. They are actually doing scientific research to determine, they currently have an FDA approval for this technology for diabetic neuropathy, and they're now looking at applications of diabetic neuropathy as created by as as indicated through exposure to Agent Orange. So that's what that study is
Thank you.
doing. Does that answer your
Yes,
question, sir?
thank you.
All right,
Appreciate it.
members, other questions? Thank you for that clarity. I appreciate that. So the others were if necessary. I don't see anyone wildly waving their hands. So, Mr. Vice Chair, please move House Bill 2727.
Madam Chair, I move that House Bill 2727 be returned with a due pass recommendation.
Members, the motion before you is House Bill 2727 be returned with a due pass recommendation. Secretary, please call the roll.
Representative Contreras.
Yes.
Representative Gress.
Aye.
Representative Hernandez.
Aye.
Representative Cupper.
Aye.
Representative Legori.
Yes.
Representative Lopez.
Aye.
Representative Luna Nahara. Aye. Representative Mathis.
Aye.
Representative Pingerelli.
No.
Representative Winiger.
Aye.
Vice Chairman Heap.
No.
Chairwoman Bliss.
Aye. Members, by your vote of 10 ayes, 2 nays, 0 present, and 0 absent, you have given House Bill 2727 a due pass recommendation.